This is our histology video on the development of the face, tongue, palate, and teeth. And I will be starting with the development of the face. So the stomidium actually starts in week 4. There's the primitive mouth, and then when it widens from the disintegration of the oropharyngeal membrane, it becomes the stomidium, increasing in depth and width. Then the stomidium becomes the oral cavity and is derived from ectoderm. Here is an image on it. And then the Mann arch starts forming in week 5. It starts with the 2 bulges of the Mann process that's used to form the mandibular arch, and it's also considered a part of the first brachial arch. The mechal cartilage is formed with the Mann process, and it gives rise to the lower face and lip. And by week 10, all of the muscle masses for the muscles of mastication have been formed to be a part of the Mann arch. In week 4, the upper face starts to form. The bulges of tissue for the frontal nasal process and the most cephalic end of it occur, and the frontal nasal process gives rise to the forehead, bridge of nose, primary palate, nasal septum, and medial nasal process. And then the medial nasal process fuses to form the philtrum, the tubercle of the lip, and the center of the nose. And then there's another image. The upper and lower lip begins at the 6th week as the fusion of the Max process and the medial nasal process, and begins the upper lip formation. And then there's another image. So let's get into the pictures. Now I'm going to be talking about the formation of the tongue. First, we start with the body of the tongue during the 4th week. It begins as a triangular medial swelling called the tuberculum impar, and is located in the midline and formed on the mandibular arch, which is also a part of the first brachial arch. The 2 lateral lingual swellings come together and merge with each other and include the tuberculum impar to form the anterior 2/3 of the tongue. Then around the 6th week, the base of the tongue starts to be formed. The posterior swellings are the copula, which forms fusion of the mesenchyme and the 3rd and 4th brachial arches, so this does not include the first brachial arch at all. Copula overgrows the hyoid arch, which is the 2nd brachial arch, and this overgrowth forms the posterior 1/3 of the tongue. Then the completion of the tongue is in week 8. The base and body merge together. The sulcus terminalis marks that fusion that happens, and the tongue moves inferiorly so the palatal shelves can grow. The palate. The primary palate formation occurs during the 5th week. The intermaxillary segment forms from the fusion of 2 mesial nasal processes. It serves as a partial floor of the nasal cavity and the nasal septum and gives rise to the primary palate. The primary palate gives rise to the premaxillary part of the maxilla. It's the anterior 1/3 of the hard plate. The secondary palate begins at week 6. The bilateral maxillary processes give rise to 2 partial shelves. The shelves grow inferiorly and deep to the stomidium alongside the tongue vertically. The developing tongue will move out of the way so the shelves can flip up and fuse together. That forms the secondary palate. The secondary palate gives rise to the posterior 2/3 of the hard palate, the soft palate, and the uvula. And then the completion of the palate ends around week 12. It happens during the 12th week. The posterior part of the primary palate meets with all 3 and form together.
the tooth development. The tooth development starts in week 6 and 7 with the initiation stage. Induction is the interaction between the tissues, and the outer ectoderm gives rise to epithelium. Growing deeper into the ectomesenchyme turns into the dental lamina. Dental lamina begins to form at the midline and moves more posterior. Next is the bud stage. The bud stage starts at week 8. The dental lamina proliferates and creates buds. There's 10 buds will be present on the future maxillary and mandibular arch. The cap stage is at week 9 through 10, when there's an uneven growth of cap shape throughout the mouth, overlying the ectomesenchyme. The cytodifferentiation, proliferation, histodifferentiation, and morphogenesis occur. Tooth germ forms. The tooth germ is the enamel organ. The enamel organ comes up with the enamel. There's the dentin papilla. The dentin papilla contains the dentin and pulp. Then the dental sac, and the dental sac is the cementum, PDL, and alveolar process. Next is the bell stage. The bell stage happens between week 11 and 12. There's 4 tissue types that develop from the enamel organ. There's the outer enamel epithelia, inner enamel epithelia, stella reticulum, and stratum intermedium. The outer cells of the dental papilla come up with the dentin and secrete odontoblasts. The central dental papilla are the beginning of the pulp. The dental sac matures into the cementum, PDL, and alveolar process. Lastly is the appositional and maturation stage at week 12. The appositional stage is when the enamel and dentin and cementum are in proper layers and mineralized throughout the matrix. And then the maturation stage is when all the dental tissues have been formed and mineralized. Starting with the palatal formation, that starts at week 5. The primary palate starts with the intermaxillary segment forms from the fusion of the 2 medial nasal processes. It serves as the partial floor of the nasal cavity and the nasal septum.